everything else around, or is it actual physical changes, like something's happened in their brain? Do you know?
That's like the $1 million question. So I'm at this big conference, international conference. Everyone's from all over the world. And when you ask them a question, how does the ketogenic diet work? Either no one agrees, or there's one thing that they agree on, nobody knows for sure. So one of the hypotheses, they say that it does affect the way the mitochondria works. So when you put a child on keto, and then the mitochondria is the energy cell. So the brain uses a lot of the mitochondria. So if you just think of it simplistically like that, if you modify the energy cell, like the mainframe of the cell, then you will probably modify the function of the brain. And it's been known, like even in Egypt, even in the Bible. Some people who have seizures, they would say that let them go away for 40 days and fast, and then the seizures go away. So it's, even in ancient literature, it's been shown to help the people with seizures, because you're using the ketones instead of the glucose. And there is some thought that maybe the glucose could be proconvulsant also.
Well, Dr. Wu said, we can do the surgery, but you're on too many seizure meds. You have to cut them down to 3 or 4 or less. We were on 6, and we couldn't do that because we tried to wean them off, and then the seizures were getting worse. Tried to wean them off another one, the seizures got worse. So then the diet had to be the next step. And then once that diet happened, we were still on the 6 for 3 years. We were on 6 seizure meds and the diet until he came home, and we started weaning them off, a year later. So it's amazing how all of it combined. And of course, when you're on 6, you don't know which one's working and which one's not, because they've thrown them all at you, and now you're trying to figure out, is this the one that's working, or is a combination of 2 or a combination of 3? So it's amazing.
So it's a combination. Yeah. You have to get to that sweet spot where the seizures go down, the child is developing, hitting some milestones, and also behavior. So one of